Hello and welcome to Irish Pregnancy and Birth, with me, Carolyn Coughlin. I'm a self-employed community midwife and board-certified lactation consultant working in the Dublin Mid-Leinster area. The mission of this podcast is to empower pregnant women with the most up-to-date information on all things pregnancy and birth by interviewing maternity healthcare professionals on a different topic every episode. For our fifth episode, we're incredibly fortunate to have paediatrician and founder of the International Breastfeeding Centre, Dr. Jack Newman. Dr. Jack Newman has been helping breastfeeding mothers and babies for over 38 years. He is an author of the definitive books, Dr. Jack Newman's Guide to Breastfeeding and Breastfeeding Empowering Parents. Dr. Newman trained in paediatrics in Quebec City and then at the Hospital for Sick Children in Toronto from 1977 to 1981. During this time at the Hospital for Sick Children, he founded the first hospital-based breastfeeding clinic in Canada in 1984. He has been a consultant for UNICEF for the Baby Friendly Hospital Initiative, where he evaluated the first candidate hospitals in Gabon, the Ivory Coast, and Canada. In 2013, Dr. Newman was awarded the Queen's Jubilee Medal for service to the community. Dr. Newman, you're very welcome to this show.
I feel very welcome.
Today we'll be talking about breastfeeding, from colostrum harvesting antenatally all the way to breastfeeding toddlers and older children. But first, I'd like you to explain to our listeners what breast milk is exactly and why it is important for babies.
Well, I won't be able to say what it is exactly because what we know about breastfeeding and breast milk changes all the time. We now know that there are thousands of ingredients to breast milk, and we know that it is a product, if you wish to call it that, that is made by a mother in response to pregnancy and birth and then the suckling of the baby. And it is a very important part of the feeding of babies, although we don't always seem to agree on this, especially health professionals don't seem to agree. Nevertheless, I wish to point out that there's a difference between breast milk and breastfeeding, and that breastfeeding is a whole different situation than breast milk, because breastfeeding is a relationship, a very close, intimate relationship between two people who are usually very much in love with each other, maybe three if there's twins. So breast milk itself provides the baby with immunity. It provides the baby with all sorts of growth factors that help to develop his various systems, including his brain. And we're learning more about it all the time. So I will not continue to describe all of breast milk because with thousands of ingredients, it might take quite a while.
Yeah. And I guess breast milk changes over time, and it also responds to the baby's individual needs. It's even different at night than in the morning. Can you tell us more about that?
Well, we already know that there's a relationship to the time of day of how breast milk is made, and recent studies have shown that there is a chronological relationship of breast milk to when it's formed, so that breast milk in the morning is different from breast milk in the night and even in the evening. Furthermore, it seems as if the amount of breast milk that is formed seems to be less in the evening than it is in the morning, so that many mothers find that the babies tend to be fussier, want to feed more often in the evening than in the morning. But all these ingredients change according to the needs of the baby, so that if the mother, for example, has some sort of infection, a viral infection, she starts to produce antibodies and other immune factors to that particular infection, so that the baby can be protected. And this, of course, is a very important issue because, people are telling mothers that if you have been exposed to COVID-19 recently, or if you're actually positive for it, then you shouldn't be breastfeeding. On the contrary, you should be breastfeeding because it's the best protection for your baby. And I think that, I don't know what it's like in Ireland, but the United States, they went crazy and said that mothers and babies should be separated. That is really just a response to hysteria. That makes no sense at all. And breastfeeding has always protected babies against infections, and if the mother gets it, it's the best way to protect the baby. So yes, so it changes all the time.
Yeah, and likewise, the baby's saliva, doesn't it communicate with the baby or the mother's milk as well? So if the baby is sick, that the mother, the saliva from the baby's milk communicates to the breast to make
Apparently, yes.
to make antibodies as well. Yeah, it's very interesting.
Right.
So I guess that leads us on to our next question. So many women feel uncomfortable about breastfeeding in public and sometimes experience negative comments when breastfeeding their children. What would you say about this experience, and how can we better support breastfeeding as a society?
Well, I think we have to make breastfeeding normal. That's all there is to it. I think that what you see in so many programs on the telly, you see in newspapers, you see in articles, you see everywhere bottle feeding, but we don't see breastfeeding. And I think that one thing that we should do is make breastfeeding the norm. And how do we make it the norm? Well, when there's an article about newborn babies in the newspaper, the photo should be of a baby at the breast, not of a baby on the bottle. And this should be true from, if you look at children's books, for example, if we're talking about my new little brother sort of thing, it's very often the little brother is being bottle fed, and it should be shown as breastfeeding. So we've got to change society. We've got to change society that thinks that bottle feeding is the normal way of feeding babies, and it shouldn't take that big a push. It makes sense. And I think that anybody who writes articles for the newspapers, if you look at newspaper articles from anywhere in the world, if it has to do with infant feeding, the photo is often of a baby being bottle fed. So we have to, mothers, go out and breastfeed in public.
Yeah.
And if somebody says anything to you, say, "Oh, piss off, will you?" I'm feeding my baby needs me, and I don't want to stay home all the time just because you have a problem with it.
Yeah, absolutely.
But we can be more polite too.
Yeah, no, we just had breastfeeding week here in Ireland, and we had a lovely photo shoot in Wicklow of all breastfeeding mothers in a field breastfeeding their babies. It was beautiful. So how long do you think women should breastfeed their babies, and is there an optimum length of time that we should give a child breast milk?
Again, breastfeeding is the best approach, but I think that this is up to the mother and the child, and I don't think there's any sort of real limit, but at some point a child will say, "I've had enough, I'm not going to do this anymore," and it becomes sort of like a co-decision, mother and child, and I think that's fair. I don't think that what many people say, if he's old enough to ask for it, then he's too old. No, he's great that he asks for it. And I will tell you that I have 3 children that were all breastfed around 4 years, and they actually did stop on their own, more or less. And that's something that a lot of mothers need to know, because I get these emails from mothers who say, is he ever going to stop? And I say, yeah, he will. Don't worry about it. I guarantee he will not go to his graduation at university and ask for mum-mums. And people get over it. That's what breastfeeding was supposed to do, was to go on for 3-4 years so that the baby is well enough, has enough immune function that he will then survive on his own. But breastfeeding is more than just milk. It is that relationship. And anybody who has breastfed for more than a few weeks knows this relationship is something special.
Absolutely, and it's great
especially
parenting.
When it's going well.
Yeah, it's a great parenting tool as well for tantrums.
Sure, absolutely.
Yeah. So is there anything moms should do before the birth to prepare for breastfeeding?
Yes, absolutely. They should get information. And because they're not going to get information from most health professionals. Most health professionals don't know the first thing about breastfeeding, and they give you all sorts of wrong information. I mean, I cannot believe it, but we still get mothers coming in saying, well, the doctor told me to feed the baby every 3 hours, 15 minutes on each side. Obviously, the doctor doesn't know what he's talking about or she's talking about if they say something like that. Get the information, and if you already gave the plug for my books, that's fine. I think that the information there is very good. We worked on that for quite a while, and we now even have a talking book or an audio book of the 2014 a book, and I think that's can be very helpful for busy mothers. They can be breastfeeding and listening, but easier than reading. But we also have a website that has a lot of information, and it's ibconline.ca. And I think that basically really knowing what to expect, knowing, for example, how to know a baby's actually drinking at the breast. We find that most mothers come into our clinic. These are usually fairly dedicated mothers who want to succeed at breastfeeding. Nobody has ever shown them how to know a baby's actually drinking milk at the breast. But that's so key. You know, many people, including health professionals, believe if the baby's got the breast in his mouth and makes sucking movements, he must be getting milk. That's not true. That's not true. And this is why so many mothers really, really don't understand what's going on with their babies. They say, I don't know, he wants to suck all the time, and I don't understand. He's so fussy and this and that. And it's because they're not told how to know a baby is getting milk. And it's not like it's a complicated issue. It's very easy to know. You just need to be shown.
Yeah. And again, as society, I guess the more women see babies breastfeeding and observing, then the more first-time mothers know if their baby is getting milk as well by watching other mothers feed.
Exactly.
Yeah. So some people recommend colostrum harvesting antenatally, where you express colostrum and freeze it while pregnant for when the baby is born. What is your opinion on this practice?
Well, I think I invented this idea. I presented this in 2004 at a conference in New Zealand, and they took it up. And one of the hospital where I spoke, they've been doing it since then, and they find that more mothers are breastfeeding now. I mean, if we lived in an ideal world, I would say, well, only mothers who have high risk for their pregnancy and birth should consider this possibility, to particularly mothers who are diabetics, especially type 1 diabetics. They should be harvesting their milk before the baby is born, so that nobody goes over and says to them, oh, no, we got to give this baby formula because you're a diabetic and there's a risk of hypoglycemia. They say, no, here's the colostrum. Here, you give it to him instead of that. But given how terrible hospital practices and information are in many hospitals, and I'm not talking about Ireland now, I'm talking about Toronto, sometimes I wonder, maybe every single mother should be expressing her milk prenatally so that they don't give the baby a formula to begin with. It's a very, very difficult decision.
Yeah, and I guess it's a time as well for mothers to get to know their breasts and understand how they work and learn the skill of hand expressing prior to the arrival of their babies. Yeah.
Yeah, fair enough. Exactly.
Yeah. If you've had any problems with previous babies, say with breastfeeding, would you recommend, like say for supply issues, would you recommend them doing anything while pregnant to increase their supply?
No, I think again it's knowing, because most mothers that don't get enough milk, it's because of hospital practices that interfere with the baby latching on, that introduce bottles right away, give formula right away. And the first few days after birth are key to getting breastfeeding underway as best possible. Yeah. And I think that the knowledge, again, is what is important.
Yeah, absolutely. So breastfeeding may be natural, but it doesn't always come naturally. And many women experience challenges, especially in the early stages of breastfeeding. What are the typical challenges moms encounter in these first few weeks, and how can they usually be overcome?
Well, I would say the three biggest problems that we see are that it hurts, and that the baby is not getting enough from the breast, and also that the baby is not latching on. Now, those are the three big ones in the first few weeks. And none of these should happen. Breastfeeding, no matter what people say, is not painful if it's working properly. And I think that what happens is, if you have pain when you're breastfeeding your baby, then get help and get it early, not wait, the 3 weeks. I mean, they used to say in Toronto, I don't know if in Ireland, they used to say, don't worry about it, it gets better in, by 3 weeks. And that is actually sometimes true. If the mother has a really good milk supply, it actually does get better. But why should the mother suffer for 3 weeks when you can fix it right away on day 1 or 2, which I've done. I mean, I saw a friend of mine's daughter was having really, as she said, toe curling pain.
Mm-hmm.
All I did was help her with the latching on day 2, and she has no more pain. I mean, seriously, it can
Yeah.
be done.
Yeah.
The same
Absolutely.
thing with the same thing with the baby not getting enough. The
Yeah.
same thing with the baby who's not latching on at all. I just actually posted on my Facebook page with regard to the babies not latching on
Yeah. 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 And
yesterday, I think.
simple positioning and attachment can, yeah,
Absolutely. It's
yeah,
breastfeeding should not be complicated.
yeah, exactly. Keep it simple. Yeah. So it's often the case that well-meaning relatives worry about that the baby is not getting enough nourishment from the breast alone and are quick to advise supplementing with substitute milk. What is your opinion on this?
Well, in the vast majority of cases, you need to fix the breastfeeding. And if the breastfeeding is fixed, then the baby doesn't need any supplements. I mean, there are women who really, truly are incapable of producing all the milk the baby needs, and that's a different situation.
Mm-hmm.
But most mothers who are having difficulty with milk supply, it's not that they could not have produced the milk. So we, just like with the sore nipples I just mentioned, you can turn these things around in the first few days if you get the help you need. And
Mm-hmm.
so most supplementation, most giving so-called formula would be unnecessary if mothers got the really good help that they deserve.
Mm-hmm. And what supports are available to women who choose to breastfeed?
Well, I mean, some health professionals like doctors and nurses and midwives actually do know how to help, and so again, get good help early, and that can make all the difference in the world. If I were in a situation where my spouse was not, the baby was not latching on, I would have somebody see her immediately within the first week,
Mm-hmm.
instead of what we see in our clinic as baby's not latching on for 6 weeks. Oh, I think I'll get a referral now. No, that's 6 weeks makes it really difficult.
Yeah.
So early, frequent, and good help are necessary, and almost all mothers will succeed at breastfeeding.
Mm-hmm. And I guess tongue ties are another common cause of breastfeeding difficulties. Can you explain how our listeners might recognize a tongue tie and what to do if they suspect this is the factor that making the feeding is difficult?
Well, often it's very obvious that a baby has a tongue tie. The frenulum, which is under your tongue there, is clearly tight. We usually decide to know by putting the fingers on each side of that frenulum and lifting. And if there's restriction in the movement, the vertical movement of the tongue, then that baby has a tongue tie. Now, if the baby is not latching on, if the baby is not getting enough from the breast, if the mother is sore, then it's something that should be done immediately.
Mm-hmm.
In some cases, actually, mothers have no problems when the baby has a tongue tie. But sometimes we see babies with tongue ties running into a problem that I call late onset decreasing milk supply. And that late onset decreasing milk supply is almost certainly due to the fact that baby has a tongue tie. There are other causes, but that's one of them. The other common cause is the mothers have been told to feed the baby on just one breast at each feeding so that the baby gets the hind milk. But if you know how to know the baby's actually getting milk from the breast, then you know that makes no sense at all. Because if the baby's not drinking milk, he's not getting hind milk because he's not getting any milk.
Yeah.
So switch.
Mm-hmm, mm-hmm, mm-hmm. Yeah, okay. So I guess we also live in busy lives. We have busy lives, you know, and how does all this busyness affect the dyad, the breastfeeding dyad?
Well, I mean, if you're doing well with breastfeeding, it's the easiest thing in the world. So, you just pop the baby on. You don't have to prepare formula. You don't have to wait for the baby to wake up. You just carry the baby around and you breastfeed. And it's not my personal experience to have ever breastfed, but my family, all my children were breastfed. And I have no doubt in my mind that when it's going well, it actually takes much less time to feed a baby at the breast than it does to feed the baby with a bottle.
Absolutely, yeah. And I guess for women who can't produce enough milk, so you mentioned that there about, so there's a small percentage of women who might not be able to make sufficient amount for their babies due to maybe perhaps lack of glandular tissue or some other factors. What options are there, if any, for them to provide breast milk for their children? And I'm thinking of breast milk banks, or is there ways that women can increase their milk supply?
Yes, all of the above. The First of all, as I want to emphasize again, most women who are not producing enough milk, it's not because they couldn't, it's because they've had bad advice and a poor start at the very beginning. But okay, yes, there is the possibility of getting bank breast milk. There's the possibility of getting donated breast milk. There are websites in the world where you can go. It's called Human Milk for Human Babies, and they they find somebody who can provide the mother with breast milk. Now, it's important to say, don't pay for what you get, because that means that there's a risk of not doing things quite right and adding formula, say, to the breast milk. So don't pay. You can do that. But the other thing is that mothers can breastfeed. First of all, you fix the way the baby latches on. Second of all, you teach the mother how to know the baby is actually getting milk from the breast. Then we teach the mother a technique called breast compression, which is essentially expressing milk into the baby's mouth. But you have to know if the baby's drinking or not. Okay. And then when that's not working anymore and the baby is only nibbling, even if you're using compression, change to the other side. Okay. Do the same thing. You can go back and forth a couple of times. But if the baby is still not getting milk and is obviously still hungry, we suggest supplementation, and it can be human milk or it can be formula with a lactation aid at the breast. This is a tube that leads from your container of milk that feeds the baby at the breast. And we try to get the mothers to do this because ultimately breastfeeding still is more than just the milk. And so if they're supplementing with formula but doing it at the breast, they're still breastfeeding.
And are there herbs or medications perhaps that the mothers can take to help increase their milk supply?
Yeah, there are a number of herbs that you can find that do it. Apparently, there's no good proof that they work. Our lactation consultants are hot on moringa these days, and apparently it does seem to work. But again, it's seeming to work is a very, very delicate situation because, anxiety, all sorts of other things may cause the mother to feel her milk supply is not as good as it should be. But these herbs may allow her a placebo effect. And there's nothing wrong with placebo effect. It works. So if the mother wants to use those herbs, fine. I tend to prefer domperidone because I know it works. And domperidone works very well, as a matter of fact. So we use domperidone in all sorts of situations. So for example, if the baby's not latching on, even if the mother's producing all the milk the baby needs, we will treat the mothers with domperidone because more milk means faster flow from the breast, means the baby is more likely to latch on. We, of course, use it when the mother's not producing enough. We even use it when the mothers have sore nipples because, again, babies tend to latch on better when the flow of milk is better. It's not the only thing we do. I mean, we're more likely to help with the latch, more likely to release a tongue tie if the mother is sore. But if that's not working, increasing the flow may work when the other things didn't.
And are there any known side effects to taking, because you take quite high doses of domperidone when you're taking it to increase your milk supply, are there any known side effects?
Well, there's no such thing as a drug that doesn't have side effects. The most common side effects we see in the first week are headache, which is usually mild and, usually passes within the first 3 or 4 days. We also see that's the most important thing, headache, and sometimes we see weight gain, but that's not in the first few days. But that weight gain is fluid, not real weight. Those are the most important things that we see. Now, there are some rare situations where a mother may have an abnormality in her electrocardiogram that may result in the mother getting serious arrhythmias. And that's pretty uncommon. It occurs in only about 1 in 10,000 people, and less commonly in women, by the way. And so, if there's a question of arrhythmias in the family, the close family doesn't, seventh cousin is not the issue. But if there's arrhythmia in the family, then we will do an electrocardiogram. And if we look for the QT interval. I know probably people listening don't care or know what a QT interval is, but that's what we really will look for. If it's prolonged, then we will not use the domperidone.
Okay, that's interesting. So I know on your website you have an information sheet just on domperidone as well.
Yeah.
In different languages as well. So our listeners can check that out. So what kind of education and training do doctors typically get on breastfeeding, and what resources would you suggest they might access to upskill in the area for any of those doctors who are listening to our show?
Well, most doctors don't get anything in their training. I can tell you that when in my 4th year medical school, which is our last year, we had 1 hour on infant feeding, and the pediatrician that spoke to us said breast is best because it always comes at the right temperature and comes in such cute containers. I know it's not politically correct anymore, but in those days, he hesitated not. And the whole rest of the hour, the only hour we got on infant feeding in our 4th year medical school was 1 hour, that hour, 2 seconds virtually on breastfeeding, and all the rest was on formula. And that's what they get. Most places, they don't get anything practical. And I can tell you at the University of Toronto, what they get, use formula if it's not working out. That's basically.
Wow. So how could we change this? How could we encourage our doctors to know more about breastfeeding?
Well, I think most doctors have a good heart and want to do the best. And I think that if mothers argue with them about, breastfeeding, and send the mothers themselves to our website, particularly the blogs. We have English blogs and we have French blogs, and you have a lot of people from Europe in Ireland these days. So French and English probably will help most of them, but we have some information sheets which are a little bit old, but we have them in several languages, including Czech, Slovak, Polish, German, Italian, Greek. So we have the blogs, which are in English and French, and we have the information sheets, which are in all these languages, and actually more than all those languages. So that's we have them in Russian too, and Spanish, okay, Portuguese.
Yeah, that's a wonderful resource to have. Yeah, brilliant. So many lactation consultants are familiar with the all-purpose nipple ointment cream you developed. Can you tell us more about it and how it might be helpful?
Well, the first thing to say, I think, is that it's a stopgap only. It's not the answer to sore nipples. The answer to sore nipples is to fix the latch, and that sometimes means release the tongue tie. And it contains an antibiotic, it contains a steroid, and it contains an antifungal agent. Now, I don't know, the antifungal agent in the UK is very difficult to get, but I think it's probably not the most important agent in there. So just with the antibiotic, mupirocin, and the steroid, which is betamethasone, most mothers will get significant relief from that combination. So if it's difficult to get the miconazole powder, leave it alone, forget it. The candida is not really the issue. I know that candida, everybody's got candida, and that's the cause of the sore nipples, but I don't think it is. Because if, candida does not grow on normal skin. So if there is pain, or if the mother actually does have candida, the problem is not the candida, because it's the abnormal skin. In other words, the damage to the nipple, which is the real problem. Fix the damage to the nipple and the candida will go away on its own.
And if mothers do choose to use this cream, should they wash it off before breastfeeding?
No. Don't wash off or wipe off. Use after every feeding. and it seems to be perfectly safe.
Mm-hmm. Great. Okay. So sometimes feeding goes fine for this first 6 weeks or so, like you mentioned, but then challenges might arise later. Are the typical causes, and how might women address these situations? So I guess you already mentioned that there's two main causes. So tongue tie, or just feeding from one breast. Is there anything else you'd like to add in there?
Yeah, those are the causes of late onset decreasing milk supply, but
Mm-hmm.
there are other causes, and doctors don't believe that the birth control pill or the IUD with hormones might affect breastfeeding. Well, they're wrong. It can decrease the milk supply significantly, and I think mothers need to know this. If they're first of all, if they're breastfeeding exclusively on demand, no pacifiers, no bottles, no nothing except breastfeeding on demand, then the chances of getting pregnant in the first 6 months are pretty small. And you know, everybody's going to phone in, or say, I don't know how they're going to react to this video. They're going to come, they're going to send in this, but I was, you know, but you know, if you're using a pacifier, that's already decreasing your protection. If you're not feeding at night, you're decreasing your protection. If you're giving bottles, you're decreasing your protection. So, you know, it's a very, very specific way of preventing births. But we know that on average, and there are variations for sure, that if a mother breastfeeds exclusively for the first 6 months and then continues breastfeeding with additional food, that the mother will become fertile on average. There's a wide variation, 14 to 17 months after the baby's birth. So that's perfect separation between mothers. That's perfect protection and time between births, right? So that if they become pregnant at 16 months, you know, they'll have a baby that's 2.5, maybe 3. Better do my math for me, okay? And that's okay. Not what we used to call. Do you know this expression? Irish
Irish
twins?
twins. Yeah, we have the
Yeah.
same expression here. Yeah.
Yeah. The mothers were not breastfeeding, I'll bet you.
Yeah, so I guess partners of breastfeeding mothers sometimes feel left out or unable to help as much with the baby's needs to reassure them. Most of the reassurance might come from the breast. What would you say to partners in this situation?
I'd say, stand back. This is your opportunity to stand back. You don't have to be feeding the baby. This idea of giving the baby a bottle so that the mother can rest, or so that you can get a better, closer relationship with the baby is not necessary. This is formula company marketing. You'll see that any of their little pamphlets that say, give the dad a chance. Right, give the dad a chance, and give the formula the chance too. No, don't worry. Don't worry. Your child will want you. You have so much opportunity to bond with your baby, but it's not the feeding part of it.
Mm-hmm. So important, yeah. So depending on where you live, and particularly in Ireland, it depends on, like, even between Cork and Dublin or Galway, about half of our mothers are breastfeeding on discharge from hospital, but this number drops off quite quickly, and by 6 months it's the exception rather than the rule. And those who breastfeed toddlers are often viewed maybe suspiciously, perhaps. What are the particular challenges faced by moms who choose to breastfeed beyond what society considers normal?
Well, I mean, we've gone through some of them. I mean, the sore nipples, the baby not getting enough, the baby refusing the breast. You know, and breastfed babies often wake up in the night, you know, and so mothers find, oh, why is he waking up? Everybody's telling me if we gave him a bottle, he would sleep longer.
Mm-hmm.
And perhaps that's true. But, you know, it's a great part of the bonding. This
Yeah.
night feedings. I used to have a painting. I don't know what happened to it, but when we moved, I lost it. It was a painting by a mother, and it was called Night Feeding, and she was so happy about the night feedings. She found it a most marvelous time between her and her baby. And so, you know, don't push it off, but don't worry. The baby is not going to wake up in the night for 17 years. I can guarantee that.
They eventually sleep.
He will eventually sleep, but don't try to force him. Don't try to force him. Don't give up the breastfeeding. You know, night feedings are an important part of breastfeeding.
Yes, absolutely. Yeah, that connection. And as well, they say that waking up so frequently at night as well, it prevents SIDS, sudden infant death
It
syndrome as
does,
well.
and
There's,
breastfeeding does too.
yeah, yeah. So are there societies or cultures that are more supportive of mums who breastfeed toddlers, or is there anything that we could do to create a similar culture here?
Well, again, the more we see breastfeeding, the more likely it is. Of course, there are cultures. I mean, even Canada has more babies breastfeeding toddlers. We're still not doing well. But in Sweden, for example, in the Scandinavian countries, they do see a lot more babies, not babies, but toddlers breastfeeding. In more traditional societies, it was very common to breastfeed toddlers and even older than toddlers. But they're losing it too, thanks to the formula company marketing.
Mm-hmm, mm-hmm. Well, that's been very interesting, Jack. So that's the end of our interview, unless you have something else to add that you'd like our listeners to hear about.
I would just say, get good help. Make sure you get good help and good support. And I know a couple of lactation consultants in Ireland who are said to be very good. I mean, I have no experience, but I've heard from people that they've helped.
Do you want to plug them?
I can't remember all the names.
Okay.
But in Dublin, there's Brigita Vajsova. And there are others whose names I can't remember, but I have them written. So if I get an email from Ireland, I will give them the possibilities.
Yeah, we have our own website anyway as well, Association of Lactation Consultants in Ireland, and the list of all the lactation consultants are on that.
Okay, great.
Yeah, so it's been fantastic having you on the show, Dr. Newman. As a lactation,
my pleasure.
Yeah, thank you.
Sorry.
No, that's great. Thank you. As a lactation consultant and breastfeeding advocate who is totally amazed by the properties of breast milk, and I've been really looking forward to this conversation. I really appreciate you taking the time out to talk to us. I've been your host and midwife, Carolyn Coughlin. I hope you've enjoyed the show. We'll be back soon with an interview, with more great interviews with maternity and healthcare professionals, so don't forget to subscribe now. If this is your first visit, have a listen to previous episodes, and we'd love if you'd give us a rating and a review. It really helps more people see the podcast. For more, keep an eye on my website, dublinhomebirth.com, or on my social media at dublinhomebirth.